So that ended up being your first job. So I guess we can kind of segue into after PA school, being a new grad. So that was your first job, the OBGYN surgery?
Yes.
Hi, everybody. Hi, happy Monday. Hi, guys. Welcome to eShadowing. You all know me. I'm Rodalyn. I'm the host of eShadowing. And today we have Laura Coral, who is a dermatology PA. Thank you so much, Laura, for coming on.
Thank you so much for having me. I'm happy to be here.
Thank you. We're excited to have you. So we're going to jump right in, guys. We're going to first start off by getting to know Laura a little bit about her journey, especially. Can you tell us how you got to becoming a PA, how you learned about the profession, and how that pre-PA journey was like?
Sure. Yeah, I didn't know about the PA career until I applied to it. I knew that I wanted to work in medicine, and I thought I wanted to be a doctor. And that was kind of like the trajectory I was on when I majored in biology, kind of like that pre-med track, and got out of school and started working doing clinical research in Boston. And that's where I started learning a lot more about all the different medical careers, all the different options there are. I actually worked with nurse practitioners, and I really liked their scope of practice. I thought it was just perfect. It was just what I wanted. But I didn't really want to go back to school and do like another 4 years of nursing. So I started researching my options, and I found out about being a PA, and it like fits so perfectly with what I wanted to do.
Oh my gosh, that's very similar to my story. Like, I didn't really want to go do nursing. I was on a pre-med track initially. Then I'm like, okay, this is not really for me. What about nursing? And I'm like, okay, I don't want to go back to school and do another 4 years and start all over. So similar to mine. That's awesome.
Yeah, that's so funny.
So how did you get patient care hours?
So because I was working in clinical research, that's what I did every day. So like my patients, my like the research participants were actually patients where I was, and we had some like minor, I had to do like a whole medical history in order to get them registered for like the study that we were doing. And we had to do like, we had to document some like, their vitals and do some like minor little procedures. So it was actually perfect. So I realized that I really liked that contact with patients. I loved talking to them. I liked having, I didn't have an impact on their health directly as a research assistant, but I knew that I wanted to have that eventually. So working with them really helped me figure that out.
Oh, that's awesome. That's great that what you did as a clinical researcher counted as healthcare experience or patient care hours, because some people are iffy about it. So.
I know. And it can be tricky because, it's not like a negligible amount of hours that you need. You need quite a few. So, it was really, really helpful to have that experience.
Wow, awesome. If you guys don't know, Laura's been a PA for 5 years. She graduated in 2016, just like I did. And you went to Johnson and Wales University, right? And University of Massachusetts for undergrad. So, so did you have to go back to school to get to finish off your prereqs, or did you already have everything? And did you have to take a gap year, I'm guessing, or?
Yeah, I took a few years. So I worked for 3 years. So I had those 3 years between my undergrad and then going back to PA school. But I did have to take a few prereqs because I think it had been more than 5 years since I'd taken them as an undergrad. So I had to redo a few of the basic ones. I think I had to take chemistry over, and I did have to do anatomy and physiology in the labs as on their own. And it was difficult to work full time and then get out at 5 and head over to school for 2 hours and, go home and do homework and all that stuff. But it was worth it. If anyone is going through that, it's so worth it at the end.
Thank you for that. Thank you for that motivation.
Yeah.
So We already have some questions coming in. Someone
Okay.
want to know what area of research were you involved in?
I did diabetes.
Okay.
I worked at a diabetes clinic. So it was mostly that, yeah.
And then someone else asked, where was your clinical experience in Boston? Just out of curiosity, as I'm a student in Boston right now.
Ooh, yeah, that's the good thing about Boston. Like healthcare is so big. So I was at the Joslin Diabetes Center, which is like right in Longwood where all like a bunch of other hospitals are.
Alrighty, guys. Well, you hear it. Whoever's in Boston wants to get some experience. Alrighty. So, how is the application process like, and interviewing, and prepping for PA school?
Oh my God. It was so intense. Like that was my whole life. I mean, I'm sure like isn't there a point in your life where that is your life? Like every single day, it's
Yes.
that's just your reality. It was difficult. It was like I applied twice. I applied because I found out like that this is what I wanted to do. I think I found out like on like a summer, and applications were due like that, like at the end of the summer to start like the following year. And I was like, oh my God, I'm just gonna do it. I'm gonna go for it. This is so cool. I found the career that I want. Finally found it. I'm gonna do it. And then and I just like rushed. And I didn't get in. It was like I only applied like to one school. And I was like so sad about it. But then I was like, whatever, I'm just gonna do it again. And then the second time I got in. So it wasn't, I would say it was difficult because I think a lot of you just a big part of like your identity, like a big part of like being in like your 20s and stuff is figuring out like your identity, like who you are, what you're gonna do.
Yes, I'm so glad you did that because I say that all the time. Yes, you can go on. I'm sorry. I'm just glad
Yeah.
you did that.
Right, yeah, it's not just a job. You're not just trying to find a job, you're trying to find like who you are and what you're gonna do. And so until you have that, you almost feel like you're like stuck in this like limbo with like you have a degree but you're not sure what you're doing with it. So it was really difficult. But I then the second time I applied, I had learned so much from that first time. So I got everything in super early, like I did it right. I did more shadowing. I don't think I'd done really that much shadowing because I just hadn't had time that first time that I applied, but then I did a lot more. And I think I just, I was more confident overall. So then that was good. So then I got in nice and early, and then it was good because then I had like a full like 8 months or something where I knew I was going to PA school, and I could just kind of relax for a little bit before that started.
Yes, that's an amazing story. That's great. And like I said, I tell students all the time, like, find yourself, figure out what you like, what you don't like, because this is going to be like, you expect to do this career for like the rest of your life, for the next, 10, 20, 30 years or whatever. So, make sure you like, you understand your likes, your dislikes, the type of life you want to live. So I'm glad you said that.
Yeah, and it's okay if it takes a while to figure out. It's okay if you're not sure and you want to take some time to think about it. I think there's a lot of pressure for everyone to just like hit the ground running with whatever you're doing. Whether you want to get into law school, med school, whatever. Like you need to get in like as soon as you can, and you need to be as young as you can to start. And like that works for a lot of people, but not for everyone. For some people, it takes a few years to decide, a little bit longer, like, graduate and get some experience and figure out, like you said, know yourself, know what you want. And if you're not 100% sure, it's okay. Like you can take your time.
Right, perfect. Yes, so someone wants to know how, we'll get into that right after. Actually, let me see. Oh, we have so many questions. Okay, so the second round, how many schools did you apply to then? Did you apply to the same school or more and not the same school? How was that the second time?
The second time around, I applied to, I think I was only planning on going to schools in the area. Luckily, there's a lot of schools in Boston, but I would say I probably applied to 5 or
Okay.
so. I don't think I didn't apply to like a ton.
Okay, awesome. So now we're going to move on to how PA school was like once you got in. And one of the first questions I see here is, how was your experience at Johnson& Wales, and were you able to maintain somewhat of a work-life balance as a student, or school life balance?
That is such a great question. I love that question. Okay, Johnson and Wales was amazing, but I didn't know it was going to be amazing. I just kind of took a chance because I was one of the students in the first year ever of the PA school. So when I interviewed, there wasn't even a building, like a PA building. They literally like showed us the window, and there was like, a mound of like gravel or something, and like a bunch of construction things. They're like, that's where you'll be. But what really did it for me was the people. And I could tell right away from the interview that like everybody there, if I was a student there, would be committed to my success, because you could just tell that they had this, like, they were creating this baby, which was the PA school, and they were like just so hopeful, and they just wanted to have an amazing first class, to break it in, and to like for them to be able to show the world what they did as a school, which is amazing. So I could tell that they would be like really committed, and they were, and it's a great school. So I would definitely recommend it. And then as far as did I have a good amount of life and or work-life balance? Definitely. I mean, PA school is going to be challenging no matter what. It's something that you have to be prepared for, and it's going to take up the majority of your time. But the good thing about my program was they gave tests on Fridays.
Mm.
So that was like, I didn't realize the importance of that. But when you think about it, if every single week you have a test on Friday, that means you like study really, really hard Monday through Thursday, but then you have the weekends off.
Yeah.
And that was really, really awesome. So I did feel as though it was intense. Like I was, studying at the library like till 10 o'clock most nights. But Friday I could have off and do like some self-care. I could like, lay back on the weekends. I definitely still study on the weekends. You still have assignments, and but it was just really nice not having like a Monday or a Tuesday exam.
Right. In my school, we had exams on Mondays and Tuesdays.
Oh,
We had
for you.
course.
Where did you go to school?
I went to Nova Southeastern University, the Fort Myers campus. I'm from Florida.
Okay.
Yeah. So I was gonna say something. Oh, I was saying that I really like the fact that although they were like a new PA program and like under provisional accreditation, and although you guys were kind of like the test subjects, the first cohort, like you still had a great experience, and they really took time to make sure that you all were ready to get out there and do well on pants and be great PAs.
Yes, they were. So I know that like there's a lot of new programs popping up, and a lot of people are like a little bit nervous about going to a new program, and I totally get that. Like I was also a little bit nervous. But if you like the people there, and if it's led by the right people, then they're going to be so invested that you do well. Like they depend on you doing well. So they're going to make that, they're going to set you up for that. So that's also a lot of value that a new program can offer.
Right. Perfect. Okay, somebody asked, was the program you attended or Johnson& Wales accredited by the time you graduated? If not, did you find it difficult to find a job after graduating from a well, technically it was provisionally accredited, because you can't, they have to be provisionally accredited, if anything. But by the time you graduated, did it gain full accreditation, or did you know?
Yeah, it was. Yeah, so I didn't have any problems at all. I got a job well before graduation, so that was nice.
Oh, that's great.
Yeah. So that was so I didn't have any problem with that at all.
Awesome. And we're going to ask you about that, about how you were able to get a job before graduating, because so many new grads have trouble finding a job, landing a job when they first get out. Sometimes it takes them 6 months to get their first job. So I'm going to definitely ask you about that. So can you tell us how, you told us a little bit about didactic. How was rotations for you? What was your favorite rotation, least favorite? Did you do a derm rotation to get into derm?
Yeah, great question. So I didn't do a derm rotation, and I wish I had, but it was an elective, and I was really interested in doing surgery, actually.
Okay.
During PA school, I had wanted to be a dermatology PA or work in plastic surgery, but then I went to PA school and like I was just so into like the medicine of everything, you know, when like you start liking like specialties that you thought you never would. Like for some reason I really liked renal, and I was like, oh my God, it would be so cool to work in renal. And like I'd never even considered it before. So so I was like, so then by the time rotations came around, I was like, you know, I want to be exposed to as much as I can. And so I kind of went for like a very surgery heavy like elective rotation. So I did like cardiothoracic surgery and yeah, and an additional gen surge. Just to like, I wanted to have that. I think that's just like the mindset that I was in. I wanted to be kind of as intense as I could be. And because of I was in the hospital, luckily all of my the rotations that were in a hospital were pretty much at the same hospital except for one. So I would be at the same hospital in doing different rotations in like different departments for like, you know, 3 or 4 months. So I got to know a few people, and one of the surgical specialties that was just opening up, which was in GYN surgery, they were hiring. And so I was able to just kind of like in that rotation talk to them and get interviewed and get the job. So that was like it really worked out rotation wise. And I felt as though if I really wanted to do derm in the future, I could it's always easier to like maybe get some experience from going into an office rather than like the hospital. So that's kind of like the route that I chose.
Right, awesome. So how soon before graduation were you able to land that job? Because that's very impressive.
It was like I want to say probably 2 to 3 months beforehand.
That's great. So that's kind of towards the end, approaching your last semester.
Yep.
Awesome. So that ended up being your first job. So I guess we can kind of segue into after PA school, being a new grad. So that was your first job, the OBGYN surgery?
Yes.
How was it doing that as your first job, especially surgery? Because I know that can be, you know, super intense and intimidating. So how was that going into that after school?
Intense and intimidating. So intense and intimidating. Oh my God. And it was like a new service, and there weren't any residents. So it was just the attendings, and then us. I was hired with another girl from my class, which was awesome. So and then us and a few other advanced practice providers, like a few NPs. But it was really fun. It was really intense. Like I didn't think it would be like that because it was a new unit. So I hadn't exactly shadowed like how it would have been. So again, I kind of went for like that, you know, I took a risk and went for that like new unit. But I thought, you know, I did a lot of OBGYN in the office, and I loved it. I liked it a lot. I loved having like all my female patients, and the OBs were great. And so I thought it would be, you know, similar to that, but it it was intense. It was really great because I learned a ton. And like, if you want to do something intense, I honestly feel like doing it after graduation is a really cool time because you're so you were so immersed during PA school. All that information is still so fresh. Um, and it was really good. I learned a ton. It was like a little bit of emergency medicine, a little bit of surgery, a little bit of clinic, and just a little bit of like hospitalist, because we, you know, being an inpatient GYN, you're doing all the ectopic pregnancies that come in at 3 a.m. and, you know, ruptured hemorrhagic cysts
Yeah.
and all that stuff. So it could be quite intense. We also did like sexual assault forensic exams, which were also a little bit intense. So it was a lot, but I mean, I would, if I could go back, I would still do that. I would volunteer to do that again because it was such a great experience. I feel like I learned a lot about myself and about taking care of patients that were outside of my scope. But I was able to learn and do it alongside the more advanced physicians and other PAs and nurse practitioners. So it was a great opportunity.
Cool. And just out of curiosity, like, how was that sexual assault, like the sexual assault cases, like? Because I work in the ER, and I mean, the ER that I worked at the longest, we would send them to like a rape center. I don't know what they would do there, but if they come in, we'd like, you know, do get their general info, and then they'd be transferred to like a rape center or a specialty area. But is that when you guys would see them, or when would you see them?
Yeah, so we were like a new service. And so we were trying to just spread our name and be like, hey, we can do this because it was a hospital that didn't previously had a GYN unit. So I think we did that in an effort to just like have more cases, but then it turned into a like little side job of its own. Like, it would be intense. I used to work nights every third week, and on some nights there would be, you know, like 2 of those coming in, plus all the other patients that we're managing on the floor that are post-op, plus any emergency case that could come in. So I remember doing the sexual assault test was like the call we don't want to get. It was like, we'd rather get like an emergent case that's going into the OR rather than have to do these tests that you have to just like do so carefully, and they take a really long time because you're doing this whole questionnaire, you're collecting evidence, and of course there's also the component where this patient, I mean, it's probably one of the most traumatic things that could have happened to them. And so, you know, it's not like you're just interviewing someone on a regular day. So they could be really difficult. So I don't know if the unit still does them, but they definitely added a lot on.
All righty. Thank you so much for that. I know time's kind of flying by, and I was so I forgot to ask questions. Okay, let me see some questions. All righty. So, someone wanted to know, what criteria did you look for when deciding which school to apply to?
Okay. So I wanted it to be in the area where I was living. Not like it didn't have to be in Boston, though I did apply to a few schools in Boston. I also liked Johnson and Wales, which is like an hour away from where I wanted. So it was important for me that I stay in New England. And I wanted a program that would offer an anatomy and physiology lab with a cadaver. So I really looked into that, made sure that was one of the components. And I think just like the sites that you'll be rotating at are really important. I know that in some places there can be a lot of competition. Like in Boston, there's a lot of competition because there's so many med schools, nursing programs and PA programs now too. So I liked that with Johnson and Wales, at that time, it was the only PA school in Rhode Island, and Rhode Island Hospital was right there. And Rhode Island Hospital is like the, one of the major hospitals in the whole state. So I knew I'd have access to that. So it's also important to look at that. And then again, like I said, the people that were involved with the program, all the professors and stuff.
Right.
Yeah.
You guys heard it. All right. And then we have a great question. What was it? Where is it? Oh, someone wanted it was a great question. Okay. What kind of questions would you ask looking back in the interview process?
Oh, that's a good question. Well, I guess it depends on what's important to you, Now, looking back, work-life balance is really important to me. So I didn't ask this, and I didn't know this going into it, but I would ask what their schedule is set up like. Do they have, breaks in between modules, or do they have, like, some programs offer vacations in between, others just go straight on. I'm like, I would ask about what days off I have, but like, I think that's really important because this is something you're going to be doing for 2 years or more. So that, looking back now, I would want to know if I'll be able to have a good balance between school and real life. I guess I would also ask what they're looking for as part of their class, so that I know if I'm a good fit or not. Like, are they really academic heavy, or are they looking for, a good, like a more well-rounded applicant, or like what kinds of other people will I be going to school with? And I would also ask about the sites where the rotations will be, how far away they'll be from you. Like, if you wanna travel, some programs are great for that because some of their rotations are in other states. But if you have a family and or you don't want to do that, you don't want to be like moving every other month, that's also important to consider, like, where will your rotations be?
Right. Thank you so much for that. Okay, so we have a bunch of derm questions, so we'll move on to your current work and specialty as a dermatology PA.
Okay.
First, was that what you did after surgery, or did you do another job and then got into derm? Can you tell us about how you transitioned into derm, especially being that it's a highly coveted specialty? Everybody wants to do derm, and I actually had my friend who's in aesthetics now. She wanted to do derm, and she was like, "Oh, it's so hard to get into derm, especially in certain regions, you can't get in at all. Some PAs be an MA in derm before being a PAC, even as working as a PAC, because it's so competitive."
Wow. It really is. Yeah. It is. That was my, I transitioned from inpatient gynecology to derm. I did that. Well, I know it's competitive, and I knew that, and I kind of like set myself up for it, that a big part of my decision. So this was when I was living in Rhode Island, was when I was working in GYN. And then I moved to San Diego in 2018. And I love, who doesn't love California? Like, I loved everything about it. But I think a big part of that for me was also, I just felt like derm and plastic surgery was almost like going to be bigger there, or I'd have a better chance of finding something in it. So literally moved across the country, and I only applied to PA to derm and plastic surgery jobs, and it was it was hard. It took me like months and months to find a job. It took me about 6 months since moving to California. So I get it. It like it is competitive, and I was getting scared, and I was like, all right, I should, maybe I should start considering, because I did, like, the thing was I was applying to only derm jobs and wasn't finding anything, like 2, 3, 4, 5 months. But at the same time, of course, I was seeing other positions for PAs, and I didn't, and one of them was perfect. It was assisting an OBGYN do robotic surgery in the hospital. And that was like a big part of what I'd done at Rhode Island Hospital, was also assist in the OR doing laparoscopic and robotic surgeries. So it was like almost perfect, like I could have, and I went, and I really liked this guy and everything, but I was really committed to being in a specialty that I really really wanted to be in. And because I'd done the whole, like, thing in OBGYN, and while it was an amazing experience, it was really exhausting for me emotionally, I think, with all the, like, some of the cases were really difficult. And also some of, working in the OR can be very difficult, and in like really high stress environments. And I was ready for something different. So I kept on applying, and it worked out with Curology. So it was perfect. It was almost like I was being tested, like, do you really want this?
Yeah.
It's going to take you a really long time. It's going to be really difficult, but if, once you commit to like doing what you want, it'll happen one way or another.
Yes, yes, yes. So, did you start off with Curology? You started off in California, and then now you're back in Massachusetts, right?
Yes, now I'm back in Massachusetts.
You were able to stay with them, just transfer.
Yeah, so with Curology, I work in telemedicine.
Oh, okay, awesome.
So I see patients remotely. Luckily, dermatology allows for that, because you can take pictures and you can tell us what's going on, and then we can go from there. Obviously, I'm not going to be able to diagnose, if you have squamous cell carcinoma, or, there are some things that are limited. But when it comes to acne, anti-aging, even like rosacea or eczema or something, things that are really easy to identify from pictures,
Yeah.
we can definitely help.
Oh, that's really, really cool. So you've been doing telemedicine since 2018.
Yep. Yep.
Awesome, awesome. So I mean, thankfully you weren't really impacted by the COVID pandemic, like at the height of the pandemic, right?
Yeah, not the way you would think. We were impacted. Fortunately, throughout this pandemic, working as a PA, I've been able to work from home and see my patients that way. But because, a lot of patients are no longer able to, we're no longer able to go into the office. We had, like, we saw a lot of patients. We were very busy as well. We were like, wow, it was really busy for some time, which was great. And it was great that we were able to, even though we're not physically there seeing patients during the pandemic, we're able to support the system in that way by already having the setup for telemedicine, and patients being able to stay at home and stay safe and still get the care that they needed. So,
Okay.
yeah.
That's really cool. Awesome, awesome. Okay, so being that it's telemedicine, sorry, how does it work? Like a day in the life, like as far as like clocking in, do you log into the computer? Is it like 8 to 5, or how are your shifts? How do I'm sure you log into a software system, charting system to see all your patients. How many patients do you usually see in a day? And being that I'm guessing you don't, like you said, see a lot of like you don't see cancer cases, and that's not really your patient population. So is it going to be younger patients with acne, or can you tell us more about that?
Of course. Yeah, everyone's always really curious about what it looks like to work in telemedicine. And in derm. Yeah, it's okay, let's see. So my day is really flexible, which is great. But it also means that I work sometimes a lot because it's always available to me. It's not like I need to go into the office and the patient needs to come in for me to see them. They're in my computer. They're on my computer all the time. So based on the type of person you are, that can be a good thing or a bad thing. But for me, it offers a lot of life work balance, which again is super important to me. So that was a no-brainer for me. I usually, we have a software where we see all our patients, where all their history and photos are kept securely. And I log in the morning, probably around 9 a.m. or something, with a big cup of coffee, and I start talking to my patients. It'll either be a new patient or a returning patient who have been on a formula that we prescribe. We prescribe formulas and then we compound them at our pharmacies and then we send them to patients' doors. So it makes it really convenient for a lot of people. A lot of my patients are adolescent, like in the adolescent age, because we do mostly acne.
Okay.
But we also do have anti-aging patients. And honestly, like I definitely the adolescents are the most likely to have acne, but I've learned that everybody gets acne. Like I've had patients in their 70s with acne, and I'm like, oh my God, I thought I'd never have to worry about acne past 30 or something, but it's definitely you see all patients. So I see mostly acne and anti-aging. I would say that's like 90% of my job easily. And then rosacea too. And then, in certain months of the summer or in the winter, we see a lot of, like dry skin or eczema, sebderm, other 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 conditions, but mostly it's going to be acne.
Okay, awesome. Awesome. That's amazing. Thank you so much for telling us more about derm. So we're going to allow you to present the case studies and the presentation that you have, and we're excited to learn more. You can share your screen with me, and or you can upload it if you go to slides and add new presentation.
Okay.
If we have time, we'll finish answering some questions.
Okay.
In the meantime, I'm going to. Is it okay if I share your like social media? Oh, you guys, Laura also has a YouTube page. Okay, she has an awesome YouTube. It's called the Coral Brief, right?
Yes, it's called the Coral Brief, and I also have I'll share with that at the end of my presentation as well.
Okay.
All right, so I'm just gonna share my screen. I think that might be easier.
Yeah, you can turn screen share. It's like at the top next to the little pen icon.
Okay.
Okay, guys, I know there's a lot of questions. This session was so amazing. And I was so into it. Sorry, guys. But we're going to make some time at the end to answer a few more questions. Let me just share our social media, guys.
Oh my God. Okay. Thank you. Okay, for some reason, I'm not able to share my screen.
Share, like, you see where it says turn screen share on? It won't let you, or?
It won't. I think it's because of the. Oh, okay, hold on. Okay, I might be able to do it now.
Okay, no problem. Take your
time. Can you see anything right now?
I don't see anything.
Okay.
Her screen, I don't see it. Let me see.
All right. So I'm going to try to upload it instead.
No problem. If you click slides, there should be like a little menu, and you click slides, and it says add a new presentation, and you'll be able to add from there. I'm just going to put your social media.
The settings of the computer.
Alrighty. The next, really quick, guys. Someone asked about the next shadowing opportunity. Our next guest for next week is going to be, let me just check the table. Okay. It's going to be in cardiothoracic surgery next week, every Monday night at 7 p.m. EST, guys. Our cardiothoracic surgery session. You want me to email it to me and try, or?
Okay, we can do that. Let me try that. Yeah, I'm going to email.
And while I get that email, maybe we can answer a few questions. Okay, someone asked about what is your favorite part about being a PA? I can't hear you. You guys hear her? Is it me or? Laura, can you hear me?
Yes, sorry, I had muted myself while I was trying to figure out how to share it. So my favorite part about being a PA, I would say, is the ability to be able to switch specialties. I think there's just like so much value in that because, you know, as your life changes, you can change, your preferences can change, or your needs of your family and everything. So it's really great to be able to, you know, just have that flexibility. I think that's just based on that was like a huge factor.
Yes.
For us to be a PA.
Not being able or having to do a residency or anything else like that, a residency fellowship. Even though there are some residency programs for PA school, it's not a requirement. You don't have to stick to one specialty and that's your life. So
Exactly. Yeah. So that was huge. I emailed you the presentation. I'm not sure if you got it.
Yeah, I got it. I'm uploading it. Yeah, it's uploading now.
Okay.
It's going to take like a minute or so we can answer more. All right. Are there any barriers? Oh, well, actually, this is a good question for dermatology, and the answer is yes. There are a lot of barriers. I remember that. But are there any barriers for prescribing isotretinoin? That's Accutane, right?
Yep.
Accutane. There's a lot of barriers. They don't just willy-nilly give that out.
yeah, definitely. I mean, it's definitely not something I prescribe because you kind of have to be like, you definitely have to be seen in person if you're going to be taking Accutane. And there's like certain blood tests that they need to do to make sure that your body is able to take the medication, that it's functioning properly while you're taking it, in addition to being on iPledge and like 2 different forms of birth control. So definitely lots of requirements to go on Accutane, and something that you would see an in-person provider for.
Oh, I didn't know that now you have to be on 2 forms of birth control. You have to be on birth control for that as well?
Mm-hmm.
Oh, well, I knew that they have to do a pregnancy test like every visit or every, time period or time frame you have to do a pregnancy test. But I didn't know that now you have to actually be on birth control.
Yep. Yep.
Wow. Wow.
Mm-hmm.
Okay. So yeah, we have the PowerPoint now. So I'm going to let Laura take the room and you should be able to control the PowerPoint.
Okay, perfect.
Sorry guys for the delay, but here we
Yeah,
go.
sorry about that.
And mind you, your skin looks perfect. All the dermatologist PAs that I talk to, their like skin's always perfect. So you are perfect for derm.
Thank you so much. Thank you. It like we all get acne, and I saw somebody comment, was like, "Oh my God, are you telling me that my acne will never go away?" And that's so funny. I mean, everyone is different. There are definitely ways that we can work with acne, which I'm going to share right now. But we all get acne, and it's so cute that you say my skin is perfect. I literally got a breakout yesterday, and I was like, "Oh, I knew it!" And it's from all the candy I've been eating because of Valentine's. So yeah, I appreciate that, but I don't have perfect skin. But that's okay because I have Curology and that helps out a lot.
All right. So I'm ready.
All right, perfect. So I'm going to get started with our case. Here, all I'm going to say is that all the photographs used in this presentation were found on an online bank or Google search, and none of these actually belonged to my patients. It's important for me that you know that because I do see my patients on telemedicine. So definitely, if you're one of my patients, and don't worry, all your photos are secure, and these are from just finding them online. So the story. So I'm going to present to you a very typical case. This is what I see every single day. It's going to be acne. It's, pretty straightforward. It's acne, but at the same time, it gives you a really good picture of what you would do if you were working in dermatology, especially if you were working in telemedicine, which is growing. So you would probably see something like this: a 24-year-old female who comes in with constant breakouts on the lower part of her face. She reports 4 to 6 breakouts per week. They're worse around her period. They're, range from small, skin colored, whiteheads, blackheads to really full, painful cysts. And even after they're gone, after the lesion goes down, there's still a dark spot that, she feels lasts forever. So her skin is never clear. So we take her past medical history, no allergies. She's on sertraline and Vivance for anxiety and ADHD. She's a pre-med student, going to school at night and working full-time as a research assistant during the day. And grad school season is coming up, or grad school interview season is coming up. So she's super stressed. She needs help clearing these breakouts so that she can feel more confident in order to go and kill it at her interviews. And she's tried salicylic acid in the past, but didn't see significant improvement. And she felt like it just irritated her skin. And she's not currently pregnant, nursing, or trying to conceive. So this is what we see on exam. We see a lot of inflammation. We see open and closed comedones, blackheads and whiteheads, a lot of pustules on the forehead and along the lower part of her face, her cheeks, her chin, and her jaw. She's also got some inflammation, some cysts, and some post-inflammatory hyperpigmentation. The rest of her body skin exam is unremarkable. And if you're able to, you want to do a full skin exam just to make sure that there aren't any other lesions. So as far as her diagnosis, we all know this is acne, and the medical term is acne vulgaris. We know this because of the way that she presented, her history. She's got pain in her lesions, a lot of inflammation, and then she has the presence of comedones, which is what determines that it's acne. And comedones are basically plugged pores. They're follicular plugs in the pilosebaceous canal, which is the hair follicle. So, oh, and she has these comedones at different stages of severity. Some are red, some are skin colored, and so there's not like a uniform stage that they're all on. Unlike this picture here on the left, which is folliculitis, it can look a lot like acne because of the pustules. But it's not acne. It has a lot of the lesions at the same stage of development, and you can see it doesn't have that comedonal presence. And then the picture on the right, it looks similar to acne as well, but her redness, her inflammation is mostly due to rosacea rather than acne. There is such a thing as acne rosacea, and acne and rosacea can definitely coexist. But like in this case, we would want to address her rosacea to reduce that inflammation. So those were also options on the differential. Well, I'll talk quickly about the pathophysiology of acne. So because this is what our treatment is based on. But what we have here on the left is a microcomedone. So this is what the inside of your hair follicle looks like. We have the epidermis here. We have a little plug forming here, and this is keratin. And here we have the sebaceous gland, which is producing sebum, an oily, waxy substance that coats the top of our skin. So when acne forms, you start having that plug get a little bit bigger, and the oil is still being secreted from the gland into the pore. So but it's not able to get out onto the surface of the skin. So it's kind of pooling up in that hair follicle. And when the opening of the skin of the pore there is closed, it's known as a white head. And when it's open, it's a black head because the contents inside are oxidized and they turn black. But basically, it's a form of non-inflammatory acne. Later on, inflammation occurs because of that backed up sebum that you have in the pore, which attracts Propionibacterium, known as P. acnes, the acne-causing bacteria. And that bacteria, the presence of that bacteria, plus the effect it has on the sebum, turning into fatty acids, causes involvement from the immune system. So not only do you have a plug, you have backed up oil, you have bacteria, and now the immune system is getting involved, causing a lot of inflammation and redness. And that ultimately leads to this very ugly looking cyst right here. So the way that we're going to treat acne is by addressing those factors. So we're going to work at decreasing follicular plugging so that the blockage doesn't occur in the first place. And the way we do this is by prescribing retinoids. So, like we were just talking about, isotretinoin is an oral retinoid, but you can use topical retinoids, which is what, you mostly do when you're starting to treat acne. And basically what these do is they reduce that chance of follicular plugging. So they don't allow the comedone to form. They're comedolytic, and they also reduce inflammation. Another mechanism that we're going to target is the microbes. So we're going to decrease the bacteria inside the pore through antibiotics, both topical and oral. And these kill the bacteria, have an anti-inflammatory effect as well. And then we're also going to look at sebum production. So sebum is actually controlled by androgens, which are sex hormones. So in women, you can have an impact on the production of sebum by starting off on an oral contraceptive that includes both estrogen and progestin, or selective aldosterone antagonists such as spironolactone. Okay, so back to our patients. So that now that we know these forms of treatment we can use, we're going to tailor therapy for our specific patients. So like we talked about, we want to decrease her follicular plugging. So we're going to start her on topical tretinoin 0.01%. And tretinoin can come in all different ranges of percentages. The strongest one is 0.1%. 0.1%. And that's quite strong. Even though it's just 0.1%, it can cause a lot of dryness and skin shedding. So it's kind of difficult for some people to tolerate. So I like to start my patients off on a really low dose and work them up to a higher dose because your skin will get used to it. So I like to start them off at 0.01 so that they can, I'd rather have them be able to tolerate this medication for, 4 or 5 days a week rather than just use it twice and, stop using it or only use it once a week. So, so I'm going to start her on that. And then I'm also going to start her on a topical antibiotic like clindamycin. And I'm going to ask her to use it with benzoyl peroxide or another antimicrobial like zinc soap. And this decreases the risk of antibiotic resistance. And so we've got the topical tretinoin, we've got the topical clindamycin. You don't always have to use oral antibiotics, but because she mentions that interview season is coming up and it takes 6 to 8 weeks to really be able to see results with topical medications because your skin needs to turn over a few layers. I'm also going to start her on oral doxy at 100 milligrams per day because that's going to just speed up everything and help with that inflammation. And then as far as managing the sebum so that, that she's producing less sebum, which can help with acne, we're going to discuss oral contraceptives, particularly those that contain drospirenone, because that one progestin can actually act as an anti-androgen, thus inhibiting the release of sebum. Basically of this oil. And then we'll also provide education. I love to talk to my patients about just good skincare practices to decrease the risk of getting acne in the long term. And we'll follow up in 6 to 8 weeks. So as far as education that I provide, it's mostly lifestyle changes, some of them really small, some of them bigger, that can help with acne. A big one is skincare products. A lot of skincare products contain comedogenic or pore clogging ingredients. And so you guys saw my graphic with all the pore clogging and all the stuff that's going on inside this pore. And then if on top of that we're using products that clog the pores, it's not going to help out. So it's important to look at the skincare products, particularly makeup, even sunscreen and moisturizers, and make sure that they're not clogging your pores. You can look online, their ingredients. We also talk about diet. There's a lot of confusion. It's not really fully known whether diet really does cause breakouts, but we do know that diet, especially foods with a high glycemic index, so foods that contain a lot of sugar, they do increase the production of sebum, and they also increase inflammation, which are two huge components to acne. So, if a patient has tried a lot of different things and, they notice that they're breaking out after eating certain type of food, I always recommend, what happens if you don't eat, if you don't drink milk for 2 weeks or something like that. And some people see a difference. And then, of course, self-care, love yourself. In dermatology, we do see a lot of patients that are really affected by the way that their skin looks, about breakouts. And, in the world that we live in with Instagram filters and all that stuff, a lot of people, a lot of people just come to me and they just want this perfect glossy skin that you see all over social media. And, you don't realize that we actually have pores, and inflammation and hyperpigmentation. And so just loving yourself throughout it all and not assigning any a particular value to yourself based on the way you look is important. Okay, so at our follow-up appointment, We have our patient come back in 6 to 8 weeks. She's doing great. Her breakouts have decreased, though she still gets a few per week. And she's now on birth control, tolerating her medications well. She still has a few scattered comedones and some hyperpigmentation on the affected areas, but she's doing really great. So at this point, I would discontinue the oral antibiotic doxy, because you don't want to keep patients too long on antibiotics if you can avoid it. And then I will increase her tretinoin to 0.025 because she's tolerating her 0.01 really well. We'll continue the clindamycin, topical clindamycin, and the benzoyl peroxide. And then, Rhodolene is gone. Okay, now she's joined. Okay. We're almost done here. And then, and we'll have her follow up in a year, or if you're a Curology patient, you can follow up before then.
Hi.
Hi.
I'm so sorry.
No worries. I didn't realize, like, I thought it was just my computer or something, but then I saw you logged back on.
That was so weird. It logged me out of nowhere. I'm sorry. I was like wondering and hoping that it didn't kick your PowerPoint out.
No, I think we made it through. I think, like, I didn't stop at all, and everything was functioning well for me. So I think we made it through.
Okay, thank you so much. I think I only missed a minute of that, but thank you. I saw actually a few people said in the chat that you should really be a professor, because the way you explained that, and I was thinking that too. I was like, oh my gosh, she's explaining this so well. I didn't even. The way in PA school, they didn't even teach it to us like that. They, just read out the PowerPoint, didn't really break it down. I loved how you broke it down to like the comedones, explaining the difference between black heads, white heads, and why it's that way. Like, you did amazing. Great job at teaching.
Oh my God, thank you so much. This made my day, you guys. I I also didn't understand acne that way. And it was, I had a hard time in PA school with derm, to be honest, but Curology has when I joined, I didn't know, I hadn't done derm, and then they're just so great. So I was able to learn a lot with them. But yeah, I mean, if you can understand how it goes from being that blackhead to that inflamed cyst, and you can understand the mechanism behind it, it becomes more intuitive as to what we're gonna do.
Yes. Thank you so much. And you guys all see her Instagram and her YouTube, Laura Coral PAC and the Coral Brief. Thank you so much. We have one more question I always like to ask our guests this. What one piece of advice you give to students? I know we were not able to answer all questions, guys. I'm sorry. It's actually 8:08, but you guys have her Instagram. I hope you guys don't flood her DMs, but thank you for providing your social media. Before we go though, one last piece of advice you have for all the pre-PA students as they, journey through the PA, becoming a PA, being a pre-PA student, getting ready to apply this April, whether, they may be seniors, juniors, freshmen. What advice would you give them?
I would just say to believe in yourself, believe that you are ready for this, believe that you've got this. You show up to that interview they want you to be they want to choose you. They're also looking for their next person, and so I think it's important to remember that it's not you going out and people are doubting you and wondering if you can make it or not. No, they're cheering for you. They when you walk in through that door to go into that interview, the people on the other side is likely hoping like, all right, is this my person? Is this the next person we're going to accept? So I think it's just super important to remember that, and to love yourself, no matter what happens. Just like make that decision. No, whether I get in, whether I get an interview, whether, whatever, I'm going to love myself no matter what. And just like that's, so whatever happens, it's not the end of the world. You can always try again. Or maybe, you want to try something else. So that's what I would say.
Thank you so much, Laura. This whole session was amazing. Your presentation was excellent. One of the best, like, teachers.
Thank you. I'm sorry I had to do it so rushed, but
Oh, no.
I'm able to do it.
Oh, you're perfect. Thank you so much. Guys, you have her Instagram, YouTube, all the ways to connect with her. So thank you again. We hope to have you on another time.
Thank you. I
And
love that.
thank you, thank you, thank you. So you guys, thank you again. See you guys next Monday. We have a cardiothoracic surgery PA. So we'll see you all next Monday. And Laura, you can, if you press the little hang up button, the little red phone, it'll end this.
Okay. All right.
Awesome.
All right, everyone.
Bye.